Now let's talk about Doppler ultrasound imaging. You might be familiar with the Doppler effect from having heard a fire engine drive past you. As the fire engine approaches, it has one frequency, and after it passes, you hear the sound of the fire engine at a different frequency. Well, what's going on? Dr. Sheldon Cooper of the Big Bang Theory can explain for us. The Doppler effect is the apparent change in frequency of a wave caused by the relative motion between the source of the wave and the observer. You may be wondering, what does any of this have to do with ultrasound? Well, we use Doppler imaging in ultrasound in order to measure how blood flows in the body. Essentially, ultrasound is transmitted into the body, and as the blood is flowing away from or towards the transducer, it causes a Doppler shift in the frequencies of that ultrasound which has been transmitted. It is reflected back into the ultrasound transducer at a different frequency. The shift is what is used then to quantify the velocity at which that blood is flowing. Now there's continuous and pulsed wave Doppler. Continuous wave is, as the name implies, where the ultrasound is applied continuously, whereas pulsed is the more traditional method that we've talked about in this lecture. If we're looking to get depth information, we want to use pulsed wave Doppler, because if the ultrasound is on continuously, we have no way of measuring the time delay from when the ultrasound was transmitted to when it was received. However, continuous wave Doppler is much more effective at measuring and quantifying high velocities in the tissue. There are different types of Doppler as well. Audible Doppler is used in which the frequency shift, which is typically between 20 and 10,000 hertz, is played through a speaker. Essentially, you'll hear a whoosh during the systole, and it will drop during diastole. Regular users of audible Doppler become very good at performing frequency analysis. I'm going to play a little sample of what some Doppler sounds are in the heart. Now, what would this be used for? Well, it can be used to identify areas of stenosis. Where there is stenosis, you have a smaller cross-sectional area. The blood velocity would then increase as it moves through that tighter area, and the increased velocity will become an increased frequency as the blood goes past. If there's a complete occlusion of a vessel, there won't be any flow and you won't hear any sound. The next type of Doppler is spectral Doppler, in which the frequency shift is displayed on the vertical axis and time is displayed on the horizontal axis. You can use this to measure the heart rate based on the spacing between successive wave formations, and you can also, based on the frequency, the Doppler shift, use it to quantify velocity, as has been done in this spectral image. Often today, you get a combination of both spectral and color Doppler. In color Doppler, the speed and the direction of the flow has been coded into a color display, which is overlaid on a traditional B-mode image. Typically, red is used for blood that is flowing towards the transducer, and blue is used for blood flowing away from the transducer. Well, what would, in this image we have a healthy subject with their wave formation and color Doppler. What this would look like in a patient with advanced heart disease is quite different. Here we have the carotid artery, which was previously completely red. Now we're showing that it has some negative velocities just after systole. In the spectral waveform, we can see that these negative velocities, as they dip below the baseline in our spectral imaging, this suggests that something is definitely wrong in this person's flow. Typically, the brain, which our carotid arteries feed, need a continuous supply of blood, and this backflow is evidence that something is very wrong, and it is with this patient with advanced heart failure. Power Doppler is a special kind of color Doppler in which the strength of the signal is displayed as a color rather than the speed and direction information. It has increased sensitivity compared to conventional color Doppler, which is especially useful for imaging small vessels and those with low velocity flow. Down here at the bottom is a link to a YouTube video that's a nice animation demonstrating the basics of Doppler ultrasound. Some more recent applications of ultrasound that are in development include elastography. The idea is to map the mechanical elastic properties of tissues. Why would we care to do this? Well, cancerous tissues are often more stiff than surrounding tissues. For example, diseased liver, as is seen here in this image, is quite a bit stiffer than is the normal surrounding hepatic tissue. It's a lot harder to see in this B-mode image than it is in our elastography image. And here are a few of the different kinds of elastography that are being used in ultrasound. Another recent development of ultrasound is the application of 3D and 4D ultrasound. Now, when I first think about 3D ultrasound, the only thing that comes to mind is fetal imaging to get nice, pretty pictures of a baby before it's born. However, there are important applications beyond just fetal imaging. For example, here on the left we have an image of the uterus with endometrial polyps. By having a 3D image, you can see them. Both of the endometrial polyps are visible, and their location relative to one another is a lot easier to distinguish in the three-dimensional image. On the right image here is an intraductal mass in the breast. Whereas when you look at it on the 3D, you can see what's going on, whereas in our 2D image, we just see a lobular mass with a refractive edge showing in the 2D. Tissue harmonic imaging is another new development in ultrasound, recently new. The idea is that you transmit at the fundamental frequency of an ultrasound transducer, but because the tissue induces nonlinear distortions of the beam, harmonic frequencies are generated within the tissue. Those harmonic frequencies are higher frequencies, and when they are reflected and returned back to the ultrasound transducer, you receive at those higher harmonic frequencies. This allows us to get a significantly improved resolution because, as you recall, a higher frequency would result in a better resolution. A couple examples that to see in this renal cyst, you can see a septation in the in the cyst, as well as this mural nodule. This is seen on the THI image, but not on the conventional B-mode image. Additionally, in this image, we see multiple gallstones much more clearly than we would on conventional B-mode imaging. That's all we have to talk about today, but I hope you got the message that there are many, many diagnostic applications of ultrasound. These were just a few that some of my students came up with in a quick 5-minute search. Diagnostic ultrasound is a very powerful tool, and we're fortunate to live at a time when it's available to us. Hope you've enjoyed this lecture. Thank you.